My name is Dr. William, and as we are in the month of October, breast cancer awareness, I can't be silent like that without making awareness of breast cancer so that we all can take care of ourselves. We've heard of breast cancer. What does it mean? And what is the meaning of even cancer itself? When we talk of breast cancer, we say it's a cancer that's developed in the tissue or the cells in the breast that causes damages to the breast. What is cancer itself? It's a cancer is a disease that develop in the cells of the body which spread into other parts of the body. So cancer is very dangerous, it's very bad when it comes to the body. It damages the cells in the body or the tissues in the body. So we must be careful of it. Now let's look at what causes breast cancer. So with the causes of breast cancer, now we have a genetics factor, what we call family history. Then we have environmental factor, and we have what we call a lifestyle. So let me talk about the family history or genetics factor. So genetics factor that causes breast cancer can be damage of a DNA. If the DNA formation was damaged, or the mutation of the DNA when the cells were forming, if there was some damages, it can also causes breast cancer. Let's see the lifestyle that causes breast cancer. The lifestyle that causes breast cancer, we can talk of smoking, we can talk of alcoholism, we can talk of too much fat eating, we can talk of obesity, that is overweight. So there are so many causes of breast cancer that we must be careful about. Let's see the environmental causes of breast cancer, which can be radiology. So radiology can causes breast cancer. When we talk of radiologists, we are talking about too much chemicals or light rays that passing through the body. These all causes breast cancer. So please let us see the same things that show up that can signify or show a way of breast cancer. Now listen, not all signs and symptoms you will identify in your breast can show that there's a cancer in your body. That is why going to the hospital is very, very important for a doctor to examine you, to assess you, to pass you through the necessary process for it to diagnose first before you can say you have a breast cancer. Now, some of the signs and symptoms that shows breast cancer, we can talk of weight in your breast. We can talk of discharge from your nipple. We can talk of dimpling of your nipple. We can of signs and symptoms. It can be pains in the breast. It can be lump or mass in your breast. If there is a mass in your breast when you hold the detached mass. Now listen, every woman, when you are ovulating, the woman is ovulating, you can see your breast feel heavy, you feel some little mass in there. That does not or may not be a sign of breast cancer. It may be out of result of the ovulation. That is what causing that. Your period. So that's why I said don't diagnose yourself that you have a breast cancer. You must go to the hospital for the doctor to examine you, for the doctor to assess you, to confirm first before. So we must be self-aware. You must check yourself. Be assessing your breast, check your breast and see if there's discharge coming from the nipples. If you see changes from the breast, that's one you must be aware yourself. Examine yourself, assess yourself. If you feel pains in the breast, you must go to the hospital for a checkup. Now let's see some of the things that can be used to diagnose breast cancer. When you go to the hospital, the doctor can make you do X-ray. There can be ultrasound. There can be MRI. These are some of the labs or investigations that can be done to determine breast cancer. So please let us be careful. Let's take good care of ourselves. Let's manage our body. Our health is very, very important. Get access to your body. Examine your body, observe your body well, so that you can signify when there is differences in your body. Thank you so much. My name is William.